So my name is Courtney Downs. I am with Kentucky Youth Advocates. We are the backbone organization for the COSAIR for Kids Face It movement, and we are excited to have you all joining us for the 2026 10-4 day information session. So with the support of COSAIR for Kids, Kentucky Youth Advocates, and members of the multidisciplinary 10-4 day planning committee who hail from Illinois, Massachusetts, Wisconsin, and Kentucky, will share information about how they've been able to build collaborations and how they've observed 10-4 day in their states. So our goals for this info session is for everyone to leave here with a better understanding of how to organize a 10-4 day in your state, and also how to initiate some of those conversations around 10-4 Faces P with key stakeholders in your state. So we have a lot of good information to get to. Really excited again to have you all joining us, and I am going to pass it over to Dr. Mary Clyde Pierce.
So everybody can hear me, I'm guessing? Yep, okay, probably. Okay. Well, I'm Mary Clay Pierce. I'm here at Lurie Children's in Chicago, and I was one of the main people that helped develop the 10-4 Faces P, the bruising clinical decision rule, that the 10-4 day that the Kentucky group came up with the idea to have it a national day, which is very cool. So they've really been help advancing that and leapfrog that to
Mhm.
actually have a bigger
So
reach.
what do you
So
think about the winner?
what's that? Oh, so do you want to advance slides? I don't have the ability to advance them, so I don't know if you want to. Yeah. So we're just going to be talking about the 10-4, and then I'll hand it off to the people that have actually talked about how to spread this idea. So we know that bruises occur from both accident and abusive trauma. So why am I so focused and obsessed with bruises? Advance, yeah. They're the most common injury from physical abuse, and they're also the most common injury that is overlooked or deemed insignificant prior to a fatal event. And so we really think of these as sentinel injuries. And so how can we do and recognize something way before badness happens? So we first developed a rule when I was in Kentucky. Kim and I worked together with nurses in the PICU and our biostatistician, and we were able to show that bruising to the torso, ear, or neck, or bruising in children under 4 months of age, anywhere, that it actually had a high prediction for abuse. But that was in an intensive care unit. So then we actually got an NIH grant. Go ahead and advance the slide. To actually validate that rule. So we actually looked at thousands of children across the country with many different sites. We were able to validate our bruising clinical decision rule, and it has a 96% sensitivity and 87% specificity for helping differentiate abuse from accident. Again, this is a screening tool, but how exciting is that these ideas and these physical exam findings can help us start seeing the difference between an abused patient and an accidentally injured one. Next slide. So the 10-4 faces P, it's atypical and unexplained bruising. If you've got a perfect explanation for it, great. But if you don't, it's important not to look the other way, because just because it's a minor injury doesn't mean it's a minor risk. So torso means the trunk, which is the chest, abdomen, back, buttocks, GU area. And then the ear is obviously the ear and the neck. So that's the TEN, T-E-N, torso, ear, neck. And then the 4 stands for bruising anywhere on an infant that's 4 months of age and younger. So any bruising anywhere ended up predicting abuse with a higher sensitivity and specificity. And then faces, literally on the face, it stands for your frenulum. You have 3 of those in your mouth. The angle of your jaw, like literally right at that angle. The cheek, that fleshy part of the cheek, not the zygoma, but that fleshy part. Your eyelids, not your orbital rim, but literally your eyelids. And then the subconjunctiva. If you have redness in your red, if you had a hemorrhage in your subconjunctiva, that actually is a bruise too. So that's also part of the faces. So yeah, that's what 10-4 faces stands for. And the P stands for patterned. If you have that obvious pattern like a hand slap or belt mark or loop marks. So that's what 10-4 faces P is. And we have these cards available. If you the little QR code there, we wanted to try to standardize how people were using this message, because some people were getting it off or a little bit wrong, and so we were able to actually have an agency develop this card for us so that it's more standardized. These there's no copyright. We want people to use this. We're thrilled for people to use this, so you don't have to get permission. So if you would like, you can just go to that QR code and you can actually have this available and print them off as much as you want and use them, put them up poster size, small size, badge size, whatever, to try to get the message out there. And then we published a paper. This is a free publication in JAMA Open. And so we're very excited. We especially liked our composites because we had so many people tell us that we developed a humogram. We call it the humogram that actually shows the locations of bruises in abuse versus accident patients. And so just being able to see the difference in how different abused children are versus those accidentally injured children, kind of like a composite of all the children in the study. Go to the next slide, I think. You can see how the sides of the face and other parts of the body are quite meaningful and different between abuse and accident. Next slide. And then the one area, see that angle of the jaw, you can see along that jawline underneath there. That was a real strong predictor. It had one of the strongest predictors for abuse versus accident. It also had a high correlation with having more internal injuries and in future fatalities. So that's a bruise that really has to be paid very close attention to. You can see the bottom row of the non-abuse patients. Children bruise that chin all day long. Several people on this call probably have had that bruise or even have stitches underneath that area where it's a common area for accidental injury, but abuse patients are being grabbed and that's why they bruise differently. And then we published this little graph here, and I know that's too complicated to actually remember. So what we did was we made an app, and that has every single region showing the difference. A angle of the jaw, for example, had a likelihood ratio of 154 being abuse versus accident, and subconjunctival hemorrhage 129. So these are big, big differences between abuse and accident. You can go to the next slide. And this is a free app. It's actually free. It's still alive right now. Hopefully, we can keep it alive. And it's called LCAST, LCAST. If that's what you look up under Apple or either Android or Apple. If you look under LCAST, it'll actually let you download this app and that little 3D model that looks like a Martian on purpose. It actually has encoded information in it, so it'll actually you can put down what you're seeing in your patient. It doesn't. We don't track you. You can't put patient identifiers in, but you can actually put the findings of your patient, and it'll help you compare your patient to all the several thousand patients we had in our study. And people have said it's been really helpful. It also has resources where you can click on under resources, and it'll actually take you to publications and the PubMed articles, so that you can see the evidence that's used not only just for our bruising study, but for fractures, brain injury, abdominal injuries, skeletal surveys, etc. Yeah. And I think who takes this over now? I don't think it's me. Is this Shannon? Is this you or?
Yep, I can jump in. Thank you so much, Dr. Pierce, and I really appreciate you being on to give that really incredible background, and you do it so well. So we're grateful that you could join us even as you're moving into to your next shift. So thank you all so much for being on today. I'm Shannon Moody with Kentucky Youth Advocates. I'm going to give a little bit of background on kind of the beginnings of TEN-4 Day, inspired by the work that Dr. Pierce and others on this call and not on this call contributed as far as the research goes, and then talk a little bit about how this all went down. So, as you can see on this visual, we had a first TEN-4 Day in Kentucky in 2019. And as you can imagine, in 2020, things shifted quite a bit for everyone around the world. So we also shifted a bit, but it actually created some opportunity for virtual engagement that we did not anticipate. So I'll talk through a little bit about the first TEN-4 Day on the next slide, and then talk about how that has spread beyond Kentucky in the couple of years following. So the Co-Stand for Kids movement, Face It movement, is a child abuse prevention movement and campaign here in Kentucky. It's statewide, and our focus is a couple of things. The first is around addressing policy change on a state level through our decision makers, legislators, and potential budget investments and state investments in Kentucky. We also really focus on making sure that professionals and individuals across the Commonwealth of Kentucky have the information that they need, whether that's primary research or research that has happened all over the world to be aware of what's going on currently when it comes to child abuse and neglect prevention. So that inspired us to really start talking about the 10-4 faces P bruising rule and making sure that individuals know about that those concerning bruises as they're working with kids and families, or when bruising is maybe not concerning. So we work closely with Dr. Melissa Curry, who's a pediatric forensic pediatrician here in Kentucky, and her team, and we have provided trainings statewide around 10-4 faces P in celebration or in recognition of 10-4 Day in Kentucky. In Kentucky, social workers, nurses, medical professionals, other certified or credentialed professionals are required to do pediatric abusive head trauma training, and that's really what inspired the whole day. Is we were hosting a training and being part of a training where we were talking about the pediatric abusive head trauma, safe sleep, and 10-4 faces P bruising rule, and it generated this idea of creating a day of recognition. So that day of recognition turned into a local and statewide day of recognition in 2019. And we had our governor, our attorney general, and dozens of local leaders, including mayors, county judge executives, identify and proclaim October 4th as 10-4 Day in order to just help to spread awareness and recognition of that bruising rule and concerning bruising, and also identify strategies for abuse prevention, especially for our youngest kids 4 and under. So in Kentucky, we have seen movement across all 120 counties, and certainly have seen that proclaimed in different cities, but then have engaged our partners around the table from Illinois, Massachusetts, Wisconsin, and other areas around inciting a 10-4 Day in their area. So Dr. Chua, Dr. Pierce, Kim Kaiser, and then many others have joined in since then in helping to engage around 10-4 Day. So on the next slide, I'll cover really quickly some of what we have done. I had mentioned proclamations from our governor. We've done press releases. We have provided virtual and in-person trainings around that pediatric abusive head trauma. And then on the flip side of that, in order to balance and really focus in on prevention, we've identified opportunities to share messaging for parents when it comes to help seeking, reducing isolation, and really looking for ways to reduce stress in those stressful moments of parenting that arise sometimes daily, hourly, by the minute, depending on the stage of parenting you are in. And we wanted to acknowledge that as we identified opportunities that 10-4 Day brought. In addition to some of the practice-based opportunities and community-based opportunities with proclamations, with media stories with that training, and then parent engagement, we also have worked on opportunities for just statewide and legislative advocacy. Dr. Chua, who's on today, had identified and engaged an opportunity to connect with the American Academy of Pediatrics chapters, both on the state and local level. We've also leveraged elected and state officials to speak to the issue through this proclamations, press releases, and other op-eds or other kind of public traditional media facing opportunities. And we have worked with partners across the U.S. to continue to identify opportunities to promote and present 10-4 Day. I kind of went over this, but like I said, there are a lot of opportunities to engage in 10-4 Day. And we're going to hear from a couple of state partners about the ways that they have done that. In Kentucky, we have provided trainings to promote to professionals, especially those who are seeking CEUs. And we also will typically co-host a training with a childcare center or with our forensic pediatric teams at University of Louisville, or University of Kentucky, or other agencies that serve kids in some capacity to really help draw out professionals into these training opportunities to to really spread the word on TEN-4 Day. The multi and interdisciplinary collaboration that we've seen across the United States and in the continental United States and beyond are among our physicians, nurses, nurse practitioners, EMS, hospital administrators, leadership, social workers, researchers, and then out in other systems that serve kids and families, either on a reactive or proactive basis, like the courts, or organizations like childcare providers or home visiting programs. So we work with anyone who will work with us to help identify and share opportunities to promote TEN-4 Day. And there's a lot of opportunity for collaboration in your state as you think about your, common partners, common allies, and other folks who may be interested in promoting and engaging in TEN-4 Day. Clarissa, we're just gonna skip that slide. Yep. So we are going to hear from Kim, who is going to move into our next portion, and I'll let Kim introduce herself.
Hi, everyone. My name is Kim Kazar, and I'm one of the co-creators of the TEN-4 Faces P rule. And today we're going to hear the great work that has happened related to TEN-4 Day in Virginia and then Tennessee. So I'd like to introduce to you Serena McReynolds and her colleague Joanna Emery, and they'll share the work that's happened at Inova. And then after, Dr. Erin Wade will share her work in Tennessee. So Inova team, please take it away.
All right, my mouse would not find the unmute button. My name is Serena McReynolds. I am a pediatric ER nurse at Inova Hospital, Inova Health System in Virginia. And I have here with me Joanna Emery. She's also my coworker here in Virginia. We just wanted to introduce how we brought about bringing TEN-4 Faces to Inova. This has been a couple years ongoing project now, and we wanted to just share some of our process with the group. We realized that recognizing child abuse in the emergency department is both critical and challenging, especially when the signs are so subtle and the time pressures are high. Our work began with a simple but common problem that nurses were expected to identify bruising in children, but yet we had no standardized screening approach within the health system, no consistent documentation pathway, and no embedded clinical support within the electronic health record. It led to a lot of missed opportunities to identify abuse. Rather than focusing solely on education, we intentionally used implementation science to guide the framework from the start. The goal wasn't just to introduce the screening tool, it was to make the right practice the easy practice. We partnered with our frontline nurses, educators, informatics specialists, physicians, and our leadership to understand the real-world barriers using established frameworks throughout implementation science and design the intervention around workflow integration, clarity, sustainability, and not individual vigilance. We embedded our TEN-4 tool directly into our nursing assessment within our EMR, allowing its function as a part of routine care rather than an added task. Positive screens prompted clinical decision BPAs to pop up to support ensuring timely provider awareness and follow-up. Education was deliberate and multimodal, combining system-wide learning modules, unit champions, and local reinforcement to build confidence rather than compliance fatigue.
Good afternoon. I'm Joanna Emery as part of the team from Inova. Just as important as design was the measurement. We continuously monitored screening completion, documentation reliability, and staff confidence using transparent feedback loops to guide real-time adjustments. This allowed us to move beyond the initial adoption and focus on sustained use. The result was reliable, scaled, and spread across multiple emergency departments with high screening compliance and improved nurse confidence in identifying concerning bruising patterns. Perhaps more importantly, this work demonstrated that successful implementation is less about convincing clinicians of the evidence and more about designing systems that support clinicians to do the right thing under real conditions. What this project reinforces is a lesson applicable to any organization. Evidence does not implement itself. When evidence-based tools are paired with thoughtful implementation science, interdisciplinary partnership, and system-level support, meaningful and sustainable practice change is possible, especially in high-risk, high-stake environments like a pediatric emergency care. Our hope is that by sharing not just what we implemented, but how we implemented it, other organizations can adapt these strategies to strengthen early recognition of child abuse in their own emergency departments. We look forward to following up with this at our meeting in September.
Thank you very much. So I'd like to introduce Dr. Erin Wade. She's a child abuse pediatrician at Le Bonheur Children's Hospital, and she's going to highlight the work that has been happening in the state of Tennessee.
Hi, I'm Erin. I trained in Louisville with Dr. Melissa Curry. So I have just loved this whole process. It's so wonderful and great. But TEN-4 has become sort of my baby. I've been here at Le Bonheur and UTHSC for over 3 years now, and this has been sort of my passion project. In 2004, I was able to create our first TEN-4 conference, and this was a conference that was for medical professionals, investigators from CPS, investigators from law enforcement, and really anyone who worked with children. We had some people from like some of the psychology schools. We didn't really have anyone from the community elsewhere, but we were able to give a half-day conference about TEN-4 and physical abuse in children. We also were able to get Mayor Young, who is the mayor of Memphis, the city of Memphis. He signed a proclamation designating October 4th as TEN-4 Day. And then for the October podcast that was put on by our children's hospital, I was a guest on the podcast, and we focused on TEN-4 for that month's podcast. In 2025, some of our TEN-4 activities were scaled back a little because I was on maternity leave during October, but we were still able to get the mayor of Memphis to sign a proclamation. We were also able to get the Governor Lee of the state of Tennessee, to sign a proclamation. The Tennessee Commission on Children and Youth did an online interview with me about TEN-4 and TEN-4 Day, and they published that on all of their social media websites, and so that got some traction there. I also, in 2025, before I went on maternity leave, I started an educational program with Nashville Police Department. There is a police officer. He's a special victims unit police officer detective, and he has a special place in his heart. Even after doing SVU work for years and years and years, he has a very special place in his heart for abused children, and wanted to see what he could do on the police side of things, on the law enforcement side of things, to help with education. So he and I devised a program where in April for Child Abuse Awareness Month, and then on October 4th, all of the officers in the Nashville Police Department would receive a short training on TEN-4. We created a brochure that's handed out to all of the officers. We created the wallet-sized cards. I tried to use the ones that y'all had created, but my institution insisted that they make their own cards. So we have our Le Bonheur cards that are very similar. They obviously share the same information. So in October and then in April, all of the police officers in the Nashville Metro Police Department, they receive these cards, a brochure, and they receive a quick lecture about TEN-4 Faces P and the recognition of child abuse. So that's been going on since April of 2025 and continues to go on. We are trying to implement that for the Memphis Police Department. I'm stationed in Memphis. I mean, I live in Memphis, so you would think Memphis would somehow be easier, and yet Nashville was easier for me to do. So I'm working with Memphis Police Department now to institute a similar training program where officers will get the training twice a year. LeBonner Marketing has done some stuff with TEN-4. I'm trying to increase LeBonner Marketing's presence and assistance when it comes to not advertising, but raising awareness for TEN-4. So that was what we did last year. This was our, yes, we can go on to the next one. This was our TEN-4 Day Conference in 2024. So we had several speakers, and we can go on to the next slide, or unless anybody wants to read that more. This was just the podcast. I forgot what I put on my slide, so I've already talked about a lot of this. And then this was the interview that the Tennessee Commission on Children and Youth put on their social media pages, along with a copy of the governor's proclamation. And we got the proclamation from the mayor for both 2024, 2025, and I've already gotten it for 2026, which is exciting. And we can go to the next slide. This was our proclamation from the governor. And the next slide. Here are our cards that my institution insisted that we make. And these, again, have been handed out to the Nashville Police Department twice a year. And we're working on getting those handed out to the Memphis Police Department. And the next slide. This is the brochure that we hand out. There's another side of the brochure. I just didn't put that picture on there that provides even more in-depth information. And then this year, we're going to have a TEN-4 conference again. So we will have it on, we're actually having it on the 5th since October 4th falls on a Sunday. So we're having it on Monday the 5th. And it will have different speakers this time covering different aspects of child physical abuse. I'm continuing to work with the Nashville Police Department. I'm trying to work with the Memphis Police Department, and I've solicited a bunch of additional proclamations this year. We've already gotten proclamation from the Memphis City Mayor. We've gotten a proclamation from the Collierville City Mayor, Millington City Mayor, and Germantown City Mayor, and those are the suburbs, the small cities right around the greater Metro Memphis area. I am working on getting the governor to provide another proclamation, and I've also submitted requests for 5 additional proclamations. So I'm just determined to get proclamations from every single person that we can in the Memphis area. And so that is what we're doing.
Thank you so much to both teams for sharing the work that you've done in your areas. And for those on the call, we offer up the examples provided by the Virginia and Tennessee teams just to show some real world examples of what you can do in your local context. And so with that, we'll open this up to questions. And I think that Shannon is going to facilitate that.
I just have to say that was some kind of impressive. It's amazing, And I love all the different approaches too. It's just really, really staggering.
I know in the chat we had a question about proclamation language and if Dr. Wade would be willing to share the proclamation language. I did also include a link in, but Dr. Wade, if you've got proclamation language that you'd like to share, feel free to drop that in, or we can follow it up with an email.
I used y'all's proclamation language, so I that was not mine. I totally borrowed y'all's.
Perfect. That's what it's there for, to make it super easy. Serena, Johanna, and Dr. Wade, if there's anything else that you wanted to just also include, if you wanted to respond to any questions that are in the chat. And then also if folks, you can take yourselves off mute too to ask questions of any of our speakers.
I'm going to jump in if that's okay. I'm Amy from Michigan with the Michigan Office of the Child Advocate. And I just wanted to share kind of what we did. I want to say I appreciate all of the ideas. I've been over here like taking notes on different things that we can do, and that the app looks great. Everything, all the new resources look great. Last year, we actually did a big campaign in 2025 to distribute the video. So we had created a video that now lives on our child abuse prevention page, which is just a page within our website that has some different resources. And then we distributed the video using the resources from our licensing and regulatory affairs agency, so that we could identify anybody who was licensed in a medical field. And then also we reached out to police departments and fire departments, and we distributed emails with the documentation, so the TEN-4 card, as well as the video links that lives on our website so that we could get that out to people, and had a really good rate of, so we were monitoring all of like the click rates on the video itself. And then we even got feedback from people within the medical professional field that were just really grateful to have things like the resource, that visual resource that you guys created, which is fantastic. And then also access to videos where they could like see examples or that kind of thing to get it into their minds so that they could identify it more readily. So
Michigan has done phenomenal work. Amy, I dropped in some links based on what you had referenced. But yeah, Michigan has been doing a great job. And as a former Michigander, I'm super proud. I see a question in the chat from Stephanie Johnson, and I think it's directed towards Inova based on the context. Have there been any surprises in the implementation, or maybe it's for anyone? Have there been any surprises in the implementation or anything that was easier or harder than you thought? I think that really could go to anyone who's implemented anything.
Actually, I'll take that for Inova. It's actually been a lot easier than I think we thought. The actual process of designing the implementation to make sure we didn't miss anything took a year before we actually brought it to the bedside. But I actually had a meeting with our system team this morning, and they commented that the staff are saying it's actually a lot easier than they thought it would be to actually do the screening. And we're getting greater than 92, up to 95% compliance with doing the screening on all children that are supposed to be screened under 4 years of age. So the feedback from bedside nurses is it was actually a lot easier than they thought it would be.
That's awesome. Because I feel like we've been trying to implement, we've had several meetings with our emergency room here, and we have gotten so much pushback just about putting all of the kids in gowns. I mean, something so simple as that. So I love seeing that the work you've done, and I love hearing that. That's fantastic.
That was some of the feedback we got initially. So we put in strategies to sort of counteract that. We gave staff scripts on what to say to parents if parents were going to give them pushback for putting them into the gowns. But we designed it so the gowns was next to the scale. So it was really easy. You weigh the kid, you grab the gown. So we were trying to make it as easy as possible. I will say that with our implementation process, that's probably the one piece we haven't got quite as much compliance on. They're doing the screening, but they've actually said that they're not always changing patients into the gowns. And sometimes that's difficult because you might have hallway patients, etc. But getting the actual screening done, I'm very grateful that the staff are actually just taking the time to look and document that they have done the screening and that they're looking for these things. So It's been very successful. We've been really happy with it.
Are y'all going to publish? I mean, are you looking at this as a quality improvement that could publish, and therefore other institutions might be able to utilize your project?
We are. We're waiting. We've just done our 6-month survey of the staff, and we'll probably do a 12-month survey to see where the staff across ANOVA, and I think we have something like 8,000 nurses, their feedback on what they think, how it's gone after 12 months, and that will give us some good data to publish with. But yeah, the stuff we're seeing so far, it's great. So we're looking at publishing.
Okay, good. I would love to maybe not reinvent the wheel and use some of your work that you have used to try to change things here at our institution. That's wonderful.
Well, we'd love to share. That's the whole purpose of this. And I know we're going to do a longer presentation on September 29th for the
Great.
TEN-4 day, and we'll go into a lot more detail on how we did it, because it was setting it up was a lot. And Serena and I are both new to implementation science, so we kind of followed those frameworks, but it really did give us a guiding a sort of a toolbox to get this into place really well moving forward, and it's been very successful, so we're very happy with it.
Congratulations.
Thank you.
Yeah.
Great questions. Any other questions from folks that are on, whether you want to drop it in the chat or unmute yourself?
I would love to brag on Serena and Johanna real quick. Sorry.
Please do.
This is Miriam. I'm the Children's Surgery Program Manager at ANOVA. And the two of them, bedside nurses, have just run with this with our full support from the Children's Surgery Program as well as the Pediatric Service Line. And we're super excited. And I just wanted to let y'all know that they do have a poster presentation at the American College of Surgeons Quality and Safety. It's the Quality, Safety, and Cancer Conference this year.
Wow.
So they are getting their initial poster publication and looking forward to seeing what they write up for their written publication and what journals they're going to enter it into. So thank you, Serena. Thank you, Johanna.
Yeah. And I'll just add to that, what's exciting is that this whole TEN-4 started with a group of nurses because we couldn't get anybody else to help us. And so Kim and I were able to approach some two PICU nurses that helped us do and collect all that initial data. So without nursing, this would have never happened. So it's awesome that it's coming full circle like that, you know?
Thank you.
All right. If there are any other questions, feel free to unmute yourself or drop them in the chat. I know that we've got just a couple of more thoughts about how to get involved, or maybe if you're feeling inspired, how to take TEN-4 day to your hospital system or your state. So I'm going to pass it over to my colleague Clarissa to get us closed out here.
Hi, everyone. I'm Clarissa. I am on the external affairs team, so I do the marketing and social media communications for the Cozy for Kids Face It movement, but also for our national TEN-4 movement now, which is really exciting and fun. So I'm going to share with you a few ways to get involved and then share some examples of how that has happened from our end and ways that you can copy and do as well. So you can host or attend a training in October. So we offer trainings and we offer CEUs for a number of professions that I know Shannon already talked about, but if that's something that your state or your area could do, that'd be a really great draw to get people more aware of the tool. Securing proclamations, which I know some of you have already done. We will again this year have a sample letter that you can use, and an info sheet, the same as we did last year. So you can be looking out for that a little bit, maybe after the summer or during late summer, to have that so you can just copy and paste the language. You can host, some orgs host positive parenting events in their communities. You can spread the word on social media and in the news. You can sign up for email updates from this core planning group on our nationwide effort. So the QR code there goes to that sign up where we send out a monthly email about TEN-4 and the national work that we're doing, ways you can get involved and things like that. So sign up for that email, or you can visit ten4day.com. For those of you who cannot see your screen, it's 10 TEN and then the number 4day.com. And you can find the history of TEN-4 day from all across the US, as well as Stay tuned for updates regarding events, trainings, toolkits, and things like that. So here's some examples of some past proclamations. So this is what an example could look like. It's a lot of government agencies will have a form on their website. You can go and request a confirmation, or you can email their communications person and they can get you in touch with that. So it's a somewhat simple process, but if you have any questions about that, please feel free to reach out and I can try to help you. You can also spread the word on social media. So here are some examples of graphics from last year. Obviously, these are very FACEIT coded. We're working on developing graphics that are more national branding coded around 10-4. So ideally, that'd be a toolkit again, where you guys can pool graphics for your social media, your website, any outward facing marketing that you have that just talk about learning about the rule and where to go. And these are just examples of our ones from last year. And let's see. I guess I would just mostly encourage you guys to sign up for the email. Shannon, Courtney, and I drafted, and this internal core team provides the information for, and it's very helpful in staying up to date with everything that's going on. And that, again, we'll put the QR code at the end, and this will have everything that is the most up to date will be in this monthly email.
Awesome.
Yeah. Do I have any questions?
And stay tuned for that deeper dive into ANOVA's presentation on implementation science and implementing the screening tool, if that's something that is invigorating to you or something that feels feasible in your area.
What's in the chat? Okay, and if you have any questions, you can feel free to email myself or anyone on this core team, and we'll get back to you. Also, if you have social media and that's easier, you can just DM FACEIT, and that's me, and I can get your question to the core team.